Thank you for joining us for this COVID-19 update. Today is Wednesday, December 29th, 2021, and this is Kathy Turner, Director of Communications for the Department of Public Health and Wellness. Dr. Sarah Moyer, Director of the Louisville Metro Department of Public Health and Wellness, is your host today. Joining her are Dr. Sarah Beth Hartledge, Associate Medical Director for the Louisville Metro Department of Public Health and Wellness, Dr. Steve Hester, the Chief Medical Officer for Norton Healthcare, and Dr. Chuck Anderson, the Chief Medical Officer for Baptist Health Louisville. I'd like to remind everyone to please mute your devices and place your questions in the chat addressed to everyone. And Dr. Moyer, I'll now turn it over to you.
Thanks, Kathy. Well, happy almost New Year to everyone. I know we called an extra press briefing today. I just wanted to make sure that everyone is aware of the alarming increase in COVID cases that we are seeing here locally. And so just wanted to make sure everyone had the same data that the health department and your local hospitals are looking at as you all make plans for New Year's and going back to school next week, as well as work. So to start us off, Dr. Hartledge is joining us and can give us an update on the data.
Excuse me. Thanks, Dr. Moyer. So I am as alarmed as you are about the increase in cases. We have seen a significant uptick in the last few days in particular. And we do believe that they are new cases. So this is not a situation where we're adjusting old numbers or things like that. So if we take a look real quick here, just some high level data. So if we talk about the number of new cases that are logged in each day in Jefferson County, the average has been about 500 for some time. So 1 month ago, that was November the 29th, we had exactly 500 new cases. And as recently as 1 week ago, on December 22nd, we had 532 new cases, so right in that range. Earlier this week, so on Monday of this week, we logged 1,060 new cases. And today, 1,742 new cases. So a really dramatic increase over a very short period of time. And specifically, we have a number of cases who did the right thing by getting tested before they went to their holiday gatherings. We have 628 people as of today who tested negative in the days before the Christmas holiday and have subsequently tested positive. So even if you tested negative before your gathering, it's definitely worth testing again because we're seeing some people convert to positive. One of the major metrics that we use to track the pandemic all along is the incidence rate, and that's the number of cases per 100,000 of the population. And about 1 month ago, so again on November the 29th, the incidence rate was 28.99 cases per 100,000, and we had been pretty steady in that range for several months. About a week ago, that number started going up. So on the 22nd of December, we had an incidence rate of 49.68 cases per 100,000. And then on Monday of this week, it bumped all the way to 79.15. And today, 101.38 cases per 100,000 of the population. And this has really shattered the previous records that we had. The highest records previously were 81 cases per 100,000 back in December of 2020. And then the most recent high was 86 cases per 100,000 on November the 29th, so about 3 months ago. And this 101 per 100,000 cases is very, very high, very concerning. And by all available indicators, it's going to continue to go up and these numbers are going to get worse before they get better. Finally, I'll touch on positivity rate. So a month ago, our positivity rate across all testing in Jefferson County was 8.25%. A week ago, we were sitting around 11.5%. As of Monday of this week, that percentage was 15%, and today it's almost 20%. We've seen isolated events where positivity at certain facilities on certain days has been greater than 50%. And one important note about high positivity rate is that when it climbs very high, like the 20% that we're seeing right now, what that suggests is that we're actually, there are a lot of positives out there who are still not being tested. So it suggests to me that the number for incidence rate is a record high at 101, but that the actual number is probably much higher than that, even so. So all the indicators right now are that COVID is breaking new records every day. And unfortunately, we're going to continue to see a rise in all of those indicators for at least the short term.
Thanks, Dr. Hartledge. So huge increase in cases in just this last week. And usually, traditionally, when we have holiday weeks, our numbers are down because people are testing less. So as you said, even more reasons to be concerned. So just want to encourage everyone, if you did gather last weekend for Christmas, and you're planning on going out this weekend, please try to find a test, get tested. And most importantly, before you go back to work or school, get tested Sunday or Monday before that happens. I know as well, testing supply, I think, is still there, but starting to get limited. And so if that's the case, what should people be doing, Dr. Hartledge?
So first, I would say if you have any symptoms, just assume that you are a positive test for right now. If you have sore throat, respiratory symptoms like cough, shortness of breath, headaches, really almost anything. If you wake up feeling poorly, just start off. The safest thing is to assume that you have a positive. There are still a number of places where you can get tested for asymptomatic testing, and we have that list on our website. There are a number of urgent cares and primary care physician offices where one can get tested if you are symptomatic as well. So encourage you to get tested if need be, but if you have a hard time accessing a test, we have lists of those resources. Catalina is showing us here. So the testing sites are listed, and there are also the home tests for antigen testing kits. Unfortunately, some of the data coming out in the last day or so suggests that they may not be as accurate for the Omicron variant of COVID. And although we don't have firm genomic information back yet from a lot of the newest tests that newest positive cases, the safe bet is that there's a lot of Omicron out there. So if you have symptoms, please stay home no matter what your test says, and reach out to your healthcare provider or through our website to find a test if you need one.
Thank you. And yeah, just to add to that, we do think that majority of the cases coming in now are Omicron. Just last week, less than 50% were showing signs of Omicron in some of our testing sites. And this week, above 90% in one of our sites. So most of the people getting COVID this week, it is Omicron. And that means some different things for people. So I'm going to stop talking there and turn it over to our healthcare partners. Dr. Hester, what are you guys seeing over at Norton right now in relation to COVID and everything, right? Because we know when people fill up our hospitals with COVID, there's less room for anything else.
Yeah, I mean, certainly we've seen an increase in numbers in the hospital. Today we have about 176 patients that are COVID positive in hospital. Over 80% of those, though, are unvaccinated. So, I just continue to push that message that the vaccine really does work at keeping you out of the hospital and certainly decreasing the risk for death. And so that's so important at this phase, and especially too, very, very, very few people are getting admitted who've gotten a booster. And if they do, they've likely got some other comorbid conditions that are contributing to that. And so again, if you're eligible for a booster, we encourage those folks to go get those. We're seeing the same things, that Dr. Hartledge went through. I mean, we're seeing a lot of increased demand for testing, increased demand in our immediate care centers and our outpatient services. I think, just to reiterate the advice that obviously if you have symptoms this period, you likely have COVID. It's not, there's not a lot of flu in the community right now, not a lot of RSV. And so that's going to be the greatest likelihood. And so, just obviously, if you get to a point where you have shortness of breath or concerns, you want to seek medical attention. But likely, fortunately, the Omicron seems to be, less intense as Delta and not contributing quite as much to, bad symptoms and people ending up needing hospitalization.
Thank you. Dr. Anderson, what are you seeing over at Baptist?
Pretty much the same thing as Dr. Hester said. Since right before Thanksgiving, we were down in the 20s at our one hospital. Then after Thanksgiving, we had a small bump, kept increasing a little bit right before Christmas. And, everyone tried to stay home for Christmas, and Christmas night and the next day, we had a big jump up to about 60 to 70 patients in our hospital with it. Our whole system, just like Steve says, Floyd is in the 60s, and even the hospital out in LaGrange has 15 right now, which is a lot for them. Going back to what Dr. Hartledge said, we've admitted a lot of patients who were initially negative, and then for either persistence of symptoms or for other reason to get another testing, their second test is coming back positive. So we're seeing them so early, and then they're becoming enough virus that we can check it on the testing. But again, our ICU, we have about 11 or 12 people in the ICU right now. 9 or 10 of them, no vaccine. The 2 that are vaccinated have immunosuppression, one with a booster and one without a booster. So again, just echo what Dr. Hester said, that vaccination will keep you out of the intensive care unit and most likely keep you out of the hospital.
Thank you. Very good point. Yeah, today's the day. If you've not gotten vaccinated now yet, please sign up, get vaccinated, get boosted. I think we're close to 70% of people having one shot, but we have a lot less than that have had their booster yet. So please make sure you are signing up to get that as soon as possible. But do also remember that it takes about 2 weeks after that booster shot to really have that full protection. And so you can't count on a shot today to protect you for your New Year's Eve activities. So please also modify that accordingly. So another thing that we're hearing is that, or that we know is that the treatment for Omicron is a little bit different than Delta and other variants that we've seen before. And some of the monoclonal antibody treatments might not work or may not be working. So what are you guys seeing at your hospitals, and how are you guys changing protocols and expect to kind of meet the demand of this upcoming surge?
So I think, as you mentioned, I mean, the monoclonal antibodies have been really helpful at keeping patients out of the hospital till now, and, and been really helpful for Delta. And so I think we still do have, a Delta in the community, and certainly is contributing to hospitalization. We're continuing to use some of those monoclonal antibodies, but I think as we see more Omicron in this community, they're going to be less effective. And so in doing that, we're working through processes. There's the value of potentially doing remdesivir infusions on an outpatient basis. But, the best thing I could say on the therapy side is if you think you're at risk, obviously, if you're having symptoms that present from shortness of breath, you have other comorbid conditions, it's going to be really important to talk with your physician to understand what therapies might be available for you. Because we want to make sure that for those folks, we are doing everything we can to prevent people from getting hospitalized. It's going to be important to have that discussion based on your unique situation.
I think the other thing too that we're seeing again, from similar to the initial rise of COVID, is there's going to be shortages with this new therapies. If we're seeing more Omicron, and as Dr. Hester said, the monoclonals presently are not as effective, there's another monoclonal antibody that we use, but that's going to be in short supply for right now. So again, physician driven to who gets what treatment, or who gets the remdesivir treatment, which is a 3-day process, needs to be possibly decided more by a physician instead of just walking into a place to get your therapies, because there's more options, but which option is best for you?
All right, so monoclonal might still work, but expect short supply and long wait or maybe none in weeks coming as cases increase and we switch from Delta to Omicron. So another reason to get vaccinated and to change your habits until that vaccine has full effectiveness, because we don't have the same treatment options as we did even last week going forward. Another question, I know historically case numbers have risen before, hospital numbers have risen. How concerned are you all about the coming weeks and y'all's capacity to be able to serve our community?
Well, I think one of the things, certainly, obviously with, 18,000 employees, we have employees that live in the community. And so those folks are just as susceptible to getting COVID as everyone else. And so one of the big things as we look going forward is, making sure we're trying to protect our staff. We think that there is certainly we're seeing an increased number in the positive numbers of our employees. And so we're doing everything we can to manage in terms of making sure staffing is appropriate. We've also, I do think the CDC's recent change with the quarantining from 10 to 5 days helps all businesses be able to continue to make sure they're providing services. And while I think, it looks as if that's still able to protect folks and not increase spread. And so I think that's going to be beneficial. But I think, we're doing everything we can. In the 2 years, almost 2 years have been going through this. It feels like, we've all learned a lot. And I think, as health systems, we've learned how to adapt and make sure we're here to take care of the community.
I would echo that as well. Capacity, has been tight at times, but I still feel we have capacity. We're not holding back on any services right now. If you still have a stroke or heart attack, please go to your facility emergency room, because you can still get taken care of. But the main problem, especially over the holiday weekends, have been, our staff is sick also. So how do you juggle that as well? But capacity has been there, and so far our staff has stepped up and done what they needed to do, which has been great.
Well, thank you. Yes, we want people going to the emergency rooms if they really need emergency care and getting in the hospital. But if you think you maybe have a mild case of COVID, stay home, look for a test in the community, or just assume you have it and stay home for at least those 5 days. 10 days, if you have symptoms, wear your mask. If you don't have symptoms after day 5, I think that's probably the most important piece of that new CDC guidance, is just make sure you keep that mask on for that full 10 days if you do leave quarantine or isolation early. Before we turn to media questions, it's all three of you, Dr. Hartledge, Dr. Hester, and Dr. Anderson. What's one key point you want people to take away going into the 2022?
Just, you said it all a while ago. If you are going out, wear your mask and do everything else. We had dinner reservations, which my wife canceled yesterday. So again, I think you really need to be cautious to look at what kind of situations you're going to be in. Do you know the people you're with? Are you going to be in crowds? If you're not vaccinated, I would stay home. If you are vaccinated, still be cautious, because there are breakthroughs, and it's time for, I hate to say it's like before, but if everyone's cautious now, then definitely nobody's going to close down anything, and hopefully over the next couple of weeks get over this. But it depends on us on which way it's going to go.
One of the things I would add is just, I do think that the gatherings, being smaller, are going to be really important for this New Year's. And one of the things too, just to remember, we have a number of kids in the community who aren't eligible yet for vaccination. And we are seeing an increase in the number of kids that are hospitalized. And so, especially as you're looking at your plans and everything else, make sure that you're considering your children's health in that perspective around who is vaccinated and who's not. It's going to be really important at these events that are coming up to make sure we're protecting those kids as much as possible.
Yeah, I would just say, as we've said for 2 years now, that an ounce of prevention is worth a pound of cure. So you know how to avoid infection, wearing your mask, staying home, being vaccinated, surrounding yourself with vaccinated people, and just being risk conscious to understand their situations that you're putting yourself in, as Dr. Anderson said. So There are treatments, and that is great for those who need them. They are likely to be limited, and you don't want to be in the position of having to depend on that. So the best case scenario is to avoid the infection in the first place if you can.
Well, thank you. I think that's all very great advice, and so I hopefully everyone can enjoy their new year, but do it safely, and we can have a successful start to 2022. I'm going to turn it back to you, Kathy, for media questions, and we'll
Okay.
hit on some key points before we end.
Okay, thank you. I think this first question from Sarah Ladd, do we believe Omicron is driving this spike or still Delta, excuse me, you answered, but can you clarify, you said you saw a couple of sites that were Omicron. Can you clarify the indicator or what's telling you that it's Omicron? It's is it in the wastewater data that you're seeing?
Yeah, so our testing for variants takes a while to come back, like weeks. So we'll know into January what we're really seeing right now. But we have a few labs that check for an S gene dropout, and that about 90% coming from one site are showing that. And so we think last week it was only about 20%, and so that has greatly increased in the last couple of days. So we do think that Omicron is driving this week's surge in numbers. Prior to this week, it was Delta.
Okay, thank you. Rachel Droz with WHAS has a few questions. I think we answered the first one just now about the inevitability of people gathering for New Year's Eve and your advice. All of you gave some good advice. Are there any plans to reopen mass testing sites in the county? I don't know if Dr. Hester or Dr. Anderson, if you all have any plans, if you have plenty of capacity now.
So I would say that, I mean, we have our drive-through testing site at Breckenridge Lane and Taylorsville Road. And that's been for, quite some time. We've got, we continue to have a large number of people going through there. I think, 800, 900 a day going through there. We're testing in our immediate care centers, our prompt cares, and in our primary care offices. So we've got a lot of testing there that's available. So we probably won't be adding additional sites. There's our site at the YMCA downtown at their primary care office has testing. So I think we'll probably be sticking with those. We're doing about 2,000 tests a day. And, I think that the biggest thing is just the key on the testing is I think sometimes, and I understand completely, curiosity becomes part of the challenge, that people just want to know, even if they don't have symptoms, where they're at. And it's real important if you've been exposed, that really on the timing on that, to be honest, it's almost 5 days after your exposure before you might even develop symptoms there. And so, waiting a 3 to 5 day period after that before getting tested. But the reality is, probably the best advice in where situation is now is just to wait until, if you have symptoms, then get tested if you're concerned. But otherwise, just for the curiosity of knowing, it's going to be tough right now because testing supplies are limited nationally.
We have no plans on expanding what we're doing now, which is mostly in the offices and urgent cares as well.
Okay, thank you.
No, Kathy, I would add, with that said, that we do communicate with our colleagues locally at the hospital systems, with the state and other regions regularly, and do keep an eye on those resources. So it's something that is very far on the back burner, but is possible. And if we got to the point that we needed that those resources could be marshaled to do that.
Thank you. Dr. Moyer, do you think we should have another mask mandate in Jefferson County?
I think right now everyone should be wearing the best possible mask that they have when they are out in public places, especially indoor crowded places. So I know I'm wearing my surgical mask. If it's going to be crowded, I'll wear my N95. And so just recommend everyone else is doing that same thing right now, especially with our positivity rate at 20%. We know there's a lot of people out there that have COVID and don't know it. And so just assume that people you are close to probably have COVID. So stop and turn around if they're not wearing a mask, and keep yourself safe.
Okay, thank you. This is another question from Rachel. There are big shortages of at-home tests right now. Are we aware of anything being done to get more to the area? Dr. Moyer, can you answer that? I know you're often on some calls with state.
Yeah, so there's a shortage of the at-home tests nationally. I know the federal administration is trying to buy up all the tests all over the world right now, and so they could hold true to their promise of getting tests to everyone, but there just isn't that possibility. So keeping tests for like screening for going back to work and identifying people in that infectious period. I know that was part of the reason why the CDC did not include testing out on that day 5, is that they want to make sure that we have tests available and to identify people during that most infectious period. So we still have a few left from our CDC grant back in October. And so I don't know, Catalina, we could pull up the website so you could see places that still have some available. Very few, and it's getting less and less. So just make sure that if you have any symptoms, just assume it's COVID and stay home. If you're going to be seeing a family member that's older, especially those that aren't boosted yet, get tested, but probably do a PCR test at one of the drive-through sites. There's also some evidence that those at-home tests aren't as sensitive to Omicron, meaning that they don't pick up as well as they do for Delta. So still important to do, but it's not like a clearance. So don't assume you don't have COVID if that test comes back negative. Still make sure you're wearing that mask and keeping friends and family safe.
Thank you. And her last question, I believe Dr. Anderson and Dr. Hester addressed, but for people who may have joined us late on the live stream or the briefing, can each of you give an update on what your hospital and staffing is looking like? Like what current patient load you're seeing with regard to COVID, and then what your staffing looks like? Dr. Hester, would you start?
Sure. So I mean, we have 176 inpatients that are positive. Greater than 80% of those are unvaccinated. We've seen a small increase in the number of pediatric patients. We currently have 11 in the hospital today. And so, you know, with staffing, we are seeing increasing number of positives, but managing that and making sure we're managing resources across the system. And so, you know, doing anything we can to make sure we're able to continue to provide services and feel comfortable where we're at right now.
Same thing for all hospital staffing. You know, we have capacity, staffing is adequate. You know, we always wish you had better staffing, but we are taking care of our folks. We are in the 60s at Baptist Health Louisville. Floyd is in the 60 range, and LaGrange is around 15 right now. Our system is 9 hospitals with Floyd, the other 8 being in the state. We peaked out over 400 back in the fall, and we're in the 360 range now. So that has just dramatically, or 320 range. And again, that had increased a lot in just in the last week, as we said earlier.
Okay, thank you. Tara Bassett with the 502 Live Streamers is asking, why aren't we opening a Louvax testing site with these numbers? Dr. Hartledge, could you address that?
Yeah, I mean, our healthcare folks have already commented on the capacity for testing. There are a lot of places you can get tested, and we have those listed, but at this juncture, there's not an obvious need or really a desire from the public to have a mass testing site the way that we needed to 2 years ago. So the testing is out there, it's being done, but it's being done via doctor's offices, urgent cares, hospitals, other community sites in smaller numbers rather than through a mass site.
Okay, thank you. This question is from Sarah Ladd of the Courier Journal. Dr. Hartledge, can you confirm that the 20% positivity rate is a record high?
I'm looking to confirm that right now, and I'll get back with you on that, Sarah. I believe it is, but I will confirm that for you.
And this question is from Deb Yetter of the Courier Journal. I believe we've answered Deb's first question about hospital capacity. Dr. Hartledge or Dr. Moyer, is our health department lab had this software update to be able to do our own testing for Omicron variant yet?
We have received it. I don't think that we have, I don't think that it's been implemented yet, but it should be very soon, like within the next days or the first week of the new year.
Okay, thank you. This question is from April Rickert of WFPL. Are you seeing, Dr. Hester, Dr. Anderson, are you seeing new symptoms that didn't present as much with Delta?
Not really. I think we've not really seen anything different. I mean, they've all been consistent throughout the pandemic. Maybe
Yeah,
less complaints. This is just, not anything that's measured, but maybe fewer complaints of loss of taste and smell.
Only thing I'm impressed with is not new symptoms either, but you have a headache, you just feel tired. The smaller complaints, and those people are positive. So I heard one patient calling into an office, and they were questioning if they should come. They said, "I feel fine. I just woke up with a headache and feel fatigued." Well, you probably should stay home for 5 days. So again, it's the paucity of symptoms and not new symptoms, as Steve said.
Okay, thank you. Jerica Valtiero with Wave 3 News is asking, Dr. Hartledge, when you mentioned 628 people tested negative and then tested positive, how is that data being tracked? Is that from standalone testing sites or information from hospital system testing sites?
That information, that's data analysis from the contact tracing system. So they had tested negative in the days leading up to the holiday. And then we have, within the last 3 days, 628 of those people, 628 of the positives from within the last 3 days had previously tested negative prior to Christmas.
And this is another question from Jerica. How prevalent is the flu? From what she's been gathering from a handful of people, they've said they have the flu and have tested negative for COVID. Dr. Anderson and Dr. Hester, I don't know if you would like to comment on what you're seeing with regard to flu or similarities between them.
Right, we've seen very few flu cases. Obviously, the symptoms can overlap quite a bit, but I think Dr. Hester mentioned earlier about RSV. I've seen more adults, 1 or 2 with RSV versus having flu that's needed hospitalization. So again, our flu numbers are still very low compared to.
Agree. We've not seen really any significance of flu or RSV.
And that's represented in the patients who are requiring hospitalization. We have reported more than 500 new flu cases each of the last 2 weeks. So happily, most of those people are not sick enough to need to be in the hospital. But the flu shot is still a recommendation, especially for those at higher risk, elderly, other health comorbidities. But yes, we certainly have seen people test positive for one or the other. The symptoms, as Dr. Anderson said, do overlap quite a bit.
Thank you.
That's just another reminder of the importance that if you have symptoms, stay home, especially those first 5 days, whether you think it's flu or COVID or anything else. The tests aren't perfect, and so we don't want to be spreading any infectious disease, especially COVID, into January.
Okay, thank you both. Dr. Hartledge, can you comment? This question is from Tara Bassett. What proportion of positive tests are coming from home tests? And is there an estimated number in the data?
So the positive tests that we are reporting on the dashboard or that I have referenced here are positive tests through a healthcare provider and not through, including community sites, but not through home testing. Some of the home tests have the ability to report results via app or online portal, but in general, those numbers are not not reflected in the data. So I am certain that there's a large number of those tests out there being done, both positives and negatives, but that is not easily accessible data. And so what we are reporting is the firm data from healthcare provided testing, not from home testing.
Okay, thank you. This question is from Deb Yetter at the Courier Journal. Any questions, any estimate or guesstimate on how many of the new cases are breakthroughs in vaccinated people? Dr. Hurlage, do you have that info, or Dr. Moyer?
I think it's too early to have a good estimate for that. Anecdotally, the trends continue to hold that greater than 80% of patients who require hospitalization or ICU level of care are unvaccinated or not fully vaccinated. Um, and I would not expect to see a significant deviation from that. But we don't have great information on that. This is really kind of these new 1,700 new cases in one day and that sort of thing. Those are new and being evaluated and investigated, but we don't have firm information yet on the vaccination status of those patients.
Yeah, the breakthrough data that we get is through interviewing, and so we don't even get that information unless you talk to one of our contact tracers. And I guess just a reminder that we are not calling you anymore like we were 2 years ago. We're focusing our efforts on congregate care settings and places where it could spread fast and be dangerous. So please, if you test positive, stay home. And you have symptoms, stay home for 10 days. Talk to your workplace for guidance, like healthcare workers, that can be shortened. And if you have any questions, please call us at 502-912-8598. So 912-8598, especially if you have a breakthrough. If you think you have a breakthrough infection, let us know so we can add that to our data.
Okay, thank you. This question is from Rachel Droz, WHAS. We're only 4 days post-Christmas. Does this surge we're seeing even include potential new infections that happened at Christmas gatherings? What do you anticipate seeing post-New Year's Eve parties?
I would say that
that
it's very early. This is probably the leading edge of some Christmas gatherings that we're seeing in the case reports now. But you're right that we will almost certainly, we expect to see after a holiday or an event, we expect to see those numbers go up in the 10 to 14 days after the event. So we're not even to that point yet. So yes, I completely agree. We expect to see that number go up some more. And I guess additional bonus at this time of year is that we have multiple holidays and events sort of stacked right on top of each other. So, we will, I'm sure, have people gathering for New Year's Eve parties. Continue to encourage them to, surround yourself with vaccinated people, get vaccinated yourself, avoid large indoor gatherings, and wear face covering where you can. And that we will see a continued rise. It's just a matter of how big that rise will be.
Thank you. Anybody else? Dr. Hester, Dr. Anderson, Dr. Moyer want to add to that? If not, okay. This last question is from Rachel. Wants to confirm one thing you said, Dr. Hester, about testing. Would you recommend right now, when testing capacity is strained, to only get a test if you're symptomatic and or exposed and not for surveillance? Do you want to clarify, Dr. Hester?
Sure. So what following the CDC guidelines would say that certainly if you're symptomatic, you could seek testing. And then if you are exposed, you really want to wait at least a 3 to 5 day period before getting testing at that point. But just for random surveillance would really not say that it's indicated unless you know that you've had an exposure or are having symptoms. And, that's part of the challenge when we look to where we are from a testing capacity standpoint. You want to make sure that we're testing those folks who definitely need it, and make sure we're getting those folks taken care of who might need further health care and further interventions.
Okay, thank you. That's the last of our media questions. Dr. Moyer, I'll turn it back over to you for closing statements.
Thanks, Kathy. I appreciate everyone tuning in today before the new year. So hopefully this information is helpful, help you make smarter decisions as we go into 2022. So Happy New Year. Wear your mask, stay safe, and we'll see you next year.